helping make your life easier. Moms Every Day.
We're so glad you're along with us today for Moms Every Day, everyone. Getting you a little help today with our dental expert, Dr. Kristen Simpson from Simpson Dental Associates. Dr. Simpson, our topic today might be one that might be a little, might make people's skin crawl when they see these pictures. But these are some common dental problems that you see, and especially when it comes to some different gum diseases and some of the issues that we deal with our gums. Sometimes it seems like we get those little bumps or the little red bumps every now and then, and there's some common problems and some common causes of these. The first is a fluid blister by a tooth. So when we're talking about this, what is it specifically that you're looking at?
Well, if you have a blister by a tooth, more than likely it could be from infection in that tooth. If you have decay or have had trauma to the tooth. So if there's an area, it's normally infection that's draining from that tooth, and it's called a fistula. So if you do see something like that, you definitely need to see your dentist, because sometimes once you get the fistula and it drains, it doesn't hurt anymore. So you tend to not want to go to the dentist. You know, people will put that off until something hurts. So if it's not hurting, they tend to not go. But it still means there's infection there and the tooth needs addressed. If a tooth is infected, it should be either treated with a root canal to save it or taken out. So those would be the two options. And with a kid, if a kid gets one of these by one of their baby teeth, it's important that they see the dentist right away, because with kids, infections, can progress really rapidly to where it could involve their whole face, and then it can also damage to the permanent tooth developing underneath. So whenever you see any of these bumps on the gums around baby teeth, you definitely need to get your kid to the dentist. Okay,
and sometimes these can turn a little more nasty, Dr. Simpson, and sometimes they can kind of turn that blue color. What does that mean when it starts to turn that color, or if it shows up it's that color?
Well, if there's a bump that's blue, normally on kids when we see this, it's called an eruption cyst, and it's just an area where the permanent tooth is growing in underneath and it just hasn't come through the gums yet. So it's just like a little blister there, like a little hematoma there. And as soon as that permanent tooth comes in, normally that area goes away, and they'll resolve on their own. So normally they don't need any treatment, but if it tends to be getting too large to where, it's bothering the child, it can be drained. So that's something that you could take them to the dentist to have it looked at to make sure it's nothing else too.
And sometimes, typically, we may see those small little white bumps. They may show up here and there, but if they're hurting in particular and they're really, really painful, that's a problem.
Yes, well, if you have white bumps in your mouth, sometimes it could just be canker sores that come from stress or from spicy foods. And canker sores normally only stay around a couple weeks and then they'll resolve on their own. So, those, normally you'll have them in a couple spots in your mouth when they come, and you can put either Oragel, or I think there's something called Canca that you can put on them just to help with some of the pain while they're there, and then normally they'll go away. But if it's something that stayed there longer than a week or two, you definitely need to have it checked out to make sure it's nothing that could be cancerous.
That's the key right there. If it doesn't disappear on its own and you can't take care of it yourself, then come and see you. So Dr. Simpson, let's talk about the next one. This one is this one's a little nasty too. Okay, so if you develop a hard bump under the tongue or the roof of your mouth, you say that's something else you see. What is it that's causing that, or what are you dealing with?
Well, actually, this is something that's just a bony growth. It's called a tori, and a lot of people have it right under their tongue or on the roof of their mouth, or even on the outside of, like here in this picture, it's on the outside of those upper teeth. And it's just where bone grows in those spots. It could be from extra force when you're biting, or it could just be a hereditary thing where you have extra bone in those spots. And normally we don't need to do anything to treat it. It's not cancerous. If you end up losing teeth and need to get a denture or partial, sometimes we have to remove those tori, but that would be the only time.
And another common issue that you see, and I think a lot of us have probably dealt with before, is sometimes we'll get bumps on the inside of our cheek or the side of our tongue. So what is it when we develop those?
Well, a lot of times that can be just from trauma. If you're biting your cheek or biting your tongue, you can get, it's called a fibroma, and it's just a little tissue tag basically And a lot of times they're fine, but if they get in the way to where you keep biting it, we can trim that area of tissue off, and we have a CO2 soft tissue laser that we can use that really easily trims that area, and it heals pretty quick. So that could be a good way to trim that spot if it does get in your way.
And Dr. Simpson, too, the thing that we need to touch on too before we go is these are common issues that you see, but sometimes you see much more severe issues when it comes to these types of things.
That's why it's important to have your normal checkups where we do our oral cancer screenings, and we use a Velscope light to be able to help us catch these areas of irregular tissue earlier so we can do something about it.
And let all these pictures be a good reminder for you to always go and get your checkups, everyone.
Yes.
Well, Dr. Simpson, thanks for stopping by. We appreciate it as always. And thank you all at home for joining us today for Moms Every Day, everyone. We'll see you back here next time.